I'm Kate Goodin. I'm the Director of Surveillance Systems and Informatics in Tennessee, which is at the Tennessee Department of Health. My job generally entails managing our surveillance system and then different electronic data flows into the department. So things like electronic laboratory reports, electronic case reports. Our large team supports that. We use our surveillance system NBS. So our hepatitis program mainly does surveillance for hepatitis B and C, which can be chronic infections, acute infections. They can self-resolve, they can require treatment, or people can be undiagnosed and not know that they're a carrier and then turn into a chronic infection. We have high prevalence of this conditions across many populations in the US, and in around 2022, Tennessee had around 1,300 newly diagnosed cases amongst those two conditions. That's a high volume within a year. Many of these individuals are monitored for a long period of time with lab tests that are kind of tracking the progress of their disease, tracking how well treatment is working, which can happen monthly, occasionally weekly. So you're talking a lot of data coming into a surveillance system that is monitoring these individuals. We had several staff members exclusively managing that data and not having time to focus on prevention and treatment. So we had around 3 staff members exclusively doing data entry. We had someone reviewing their quality, and we had an administrative staff helping to manage that paper and faxes and other activity around data entry and data management. And that means that those staff don't have time to contact patients, to link them to care, to develop community education resources, to verify treatment, to verify vaccination, and all of the other efforts that we really want to spend our time doing. People get into public health because they want to help their communities, they want to help individuals, they want to improve the health and lives of the people we serve. Entering data into a system is not always very fulfilling for that person, and there's other efficiencies that we could build in from a systems perspective that would allow our employees and our human resources to do what people are best at, which is developing that interpersonal relationship with our community members, making sure that we're educating providers about prevention and treatment efforts, that we're making those preventative measures available to the population as they choose to participate in them. We were able to identify some common links with that laboratory data and the laboratory monitoring that would allow us to process that data in an automated fashion and still give us the same quality and quantity of information, and occasionally more information than we were getting from data entry, and again, speed up how we're tracking individuals, how we're able to describe the current state of care in our community, and how we're able to identify people who have maybe been missed, people who have fallen through the cracks and need some outreach to link them back to care and prevention efforts. Last year, we were processing almost 600,000 labs in that 3-month time period. So this automation has allowed for us to automatically process those almost 600,000 labs, again, in a 3-month time period, create new case investigations where it's appropriate, attach them to existing cases for the vast majority of those results. So we're not having a person have to review every individual lab result to make that determination. So one of the things we hope to learn from this is how we can apply it to other programmatic areas that do longitudinal surveillance. So whether that's potentially HIV infections, whether that's other chronic diseases outside of our division. This has really provided us a lot of lessons learned on what that data processing looks like, how we reconcile that data over time, and how we ensure that that data is feeding into a product that's useful long-term for both our epidemiologists, our community organizations, and other partners across the spectrum of public health within Tennessee.